If you are over 60 and you take a pill every single day to control your blood pressure, I want you to stop and think about something for a moment. Do you know exactly why you take it when you take it? Most people don't. Most people just swallow the pill with breakfast because that's when they remember, or right before bed because it's part of the nightly routine. But here's what almost nobody tells you. For years, millions of people were told there was one correct time to take blood pressure medication, and that getting it wrong could quietly raise their risk of a heart attack or a stroke. That claim spread across doctors' offices, health websites, and family group chats. And today, we're going to look honestly at what the largest and most carefully done studies on this question actually found. Some of what you've heard is true, some of it is outdated, and there is one specific situation, especially common after 60, where the timing of your pill really can matter for your safety. Stay with me, because by the end of this video, you'll know exactly what to ask your doctor and what you can safely ignore. Let's start with why this question even matters so much for people in their 60s, 70s, and beyond. Blood pressure isn't a flat, steady number throughout the day. It rises and falls in a pattern, almost like a wave. For most people, blood pressure dips a little while they sleep, then rises again in the early morning hours, often somewhere between 5 and 9 in the morning. Doctors call this the morning surge. This is actually a very old and very normal part of how your body wakes itself up. Your body releases hormones like cortisol and adrenaline to get you ready for the day, and part of that process pushes your blood pressure upward. For a healthy person, this morning rise is mild and harmless. But for someone with high blood pressure, especially an older adult whose blood vessels have become stiffer with age, that morning surge can be sharper and more pronounced. Researchers noticed years ago that heart attacks and strokes seem to happen more often in the morning hours than at any other time of day. That observation led to a very reasonable question. If mornings are riskier, would it help to take blood pressure medication at night instead, so that the medicine is at its strongest exactly when that morning surge happens? This idea, known as chronotherapy, or timing your treatment to your body's clock, became extremely popular starting in the early 2000s. A series of studies out of Spain, including a well-known one called the Hypertension chronotherapy trial, reported something dramatic. They claimed that people who took their blood pressure pills at bedtime instead of in the morning had a much lower risk of heart attack, stroke, and death from heart disease, in some reports, a reduction of nearly half. When those results came out, they made headlines everywhere. Take your pills at night to cut your heart attack risk, the articles said. Doctors began recommending it. Patients switched their routines. It felt like a simple, free way to protect your heart, just by moving your pill from breakfast to bedtime. But here is where the story gets more complicated and more important for you to understand. As other scientists looked closely at how that Spanish trial was actually conducted, they found serious problems. The way patients were assigned to the morning group or the evening group didn't look random the way it should have in a properly designed study. The size of the benefit being reported was so large that it didn't match anything seen in other similar trials of blood pressure treatment. And the outcomes weren't independently verified by outside reviewers the way major cardiovascular trials normally are. In plain language, respected researchers around the world began to say, this result looks too good to be true, and the methods used to get it don't hold up to scrutiny. So the medical and research community did what it's supposed to do when a claim is this important. They built bigger, more rigorously controlled studies to test it properly. And this is where we get to the study that really changed the conversation. In 2022, a massive clinical trial called the TIME study was published in one of the most respected medical journals in the world. This wasn't a small study. Researchers followed more than 21,000 people with high blood pressure across the United Kingdom for an average of over 5 years. Half of the participants were randomly assigned to take their blood pressure medication in the morning, and the other half took it in the evening. Then the researchers simply watched what happened over time. Who had heart attacks? Who had strokes? Who died from cardiovascular causes? The results surprised a lot of people who had gotten used to hearing that evening dosing was the secret to a healthier heart. The TIME study found no meaningful difference between the two groups. The rate of heart attacks, strokes, and cardiovascular deaths was essentially the same whether people took their pills in the morning or at night. 2 years later, in 2024, an even larger analysis combining several trials on this exact question was presented at a major European cardiology conference, and it reached the same conclusion. Taking your blood pressure medication in the evening did not lower the risk of heart attack, stroke, or death compared to taking it in the morning. Now I want to pause here and be very clear about something, because this is important. This does not mean timing is meaningless, and it doesn't mean the earlier researchers who studied chronotherapy were acting in bad faith. Science moves forward by testing ideas, and sometimes bigger, better studies correct what smaller ones seem to show. What it does mean is this. If you've been told there's one specific hour of the day you absolutely must take your pill in order to protect your heart, the strongest current evidence doesn't support that as a strict rule for most people. According to the doctors who led these major trials, patients can generally take their blood pressure medication whenever fits best into their day and whatever helps them remember it consistently. That last word, consistently, is the real key, and we're going to come back to it, because it may matter more than the actual clock time. But before we get there, I promised you there is a specific situation where timing genuinely can affect your safety, especially after 60. This is the part a lot of health content skips over, so pay close attention here. Not all blood pressure medications work the same way. Many people, especially older adults, are prescribed a type of medication called a diuretic. You may know it by a more common name, a water pill. Diuretics like hydrochlorothiazide or furosemide work by helping your kidneys remove extra salt and water from your body, which lowers the volume of fluid in your blood vessels, and in turn, lowers your blood pressure. That's a very effective and very common approach. But here's the practical problem. A water pill does exactly what its name suggests. It makes you urinate more. If you take that pill in the evening or right before bed, your body may be working overtime to flush out fluid right when you're trying to fall asleep, or in the middle of the night. For a younger person, that might just mean one extra trip to the bathroom. For someone in their 70s or 80s, it can mean 2, 3, or more trips out of bed in the dark. And that is where the real, well-documented risk comes in: falls. Nighttime falls are one of the leading causes of serious injury among older adults, and getting up groggy, half asleep, sometimes with a slight drop in blood pressure when standing, known as orthostatic hypotension, is a genuinely dangerous combination. Add poor lighting, an unfamiliar path to the bathroom, throw rugs, or reduced balance that can come with age, and you have a real recipe for a hip fracture or a head injury. This isn't a theoretical concern. It's one of the most common reasons doctors specifically advise older patients to take diuretic blood pressure medications earlier in the day rather than at night. So here is the honest, complete picture. For most standard blood pressure medications, the clock time you take them, morning or evening, does not appear to change your risk of heart attack or stroke, according to the best current evidence. But for water pills specifically, taking them too late in the day can increase your risk of nighttime bathroom trips, disrupted sleep, and falls, which is a very real safety issue for adults over 60. That's not a myth. That's a practical, well-supported piece of advice your doctor may have already given you. And if not, it's worth asking about directly. Let's talk about a few other timing-related situations that matter more than most people realize, because the story doesn't end with diuretics. Some blood pressure medications work better or cause fewer side effects, depending on whether you take them with food. Certain calcium channel blockers, for example, can be affected by what you eat around the same time, and there's a well-known interaction between some of these medications and grapefruit or grapefruit juice. Grapefruit can interfere with an enzyme in your liver that breaks down certain drugs, which can cause the medication to build up in your bloodstream at a higher level than intended. That's not about the hour of the day, it's about what's in your stomach when you take the pill, but it's exactly the kind of detail that gets lost when a video promises you one dramatic secret about the wrong time to take your medicine. If you've ever wondered why your pharmacist stuck a little warning sticker on your prescription bottle, this is often why. Another situation where timing truly matters is when you're taking more than one blood pressure medication, which is extremely common after 60. Many people are on 2 or even 3 different drugs to keep their numbers controlled. If those medications are meant to be spaced apart, Or if one is long-acting and one is short-acting, the specific schedule your doctor set up isn't arbitrary. It's designed to keep your blood pressure steady across the full 24 hours, avoiding sharp peaks or dangerous dips. This is a case where just take it whenever genuinely doesn't apply, because your particular combination of drugs may have been carefully timed for a medical reason specific to you. And then there's a mistake that has nothing to do with morning or evening at all, but causes far more harm than dosing time ever does. Inconsistency. Skipping doses because you feel fine that day. Doubling up the next morning because you forgot yesterday. Stopping a medication cold without talking to your doctor because you read something online that scared you. Blood pressure medications work by keeping a steady, predictable level of the drug in your bloodstream. When that level swings wildly, drops too low, then gets pushed back up, then drops again, your blood vessels are essentially being yanked around, and that instability is far more strongly linked to bad outcomes than whether you took the pill at 7 in the morning or 7 at night. This is really the heart of what the newest research is telling us. The old idea was that there's a single magic hour hidden somewhere in the day, and if you can just find it, you unlock extra protection for your heart. The updated, better supported idea is less flashy but more useful. What actually protects your heart is taking your medication the same way, every single day, in a routine you can realistically stick to for years, combined with the specific timing your doctor recommends for your particular drugs and your particular health situation. So what should you actually do with all of this information? Let's make it simple and practical because that's what matters most. First, don't panic and don't change your medication schedule on your own based on anything you hear in a video, including this one. If you've been taking your pills at a certain time for years and your blood pressure has been well controlled, that routine is very likely working fine for you. The goal here is understanding, not sudden change. Second, if you take a diuretic, a water pill, and you've noticed you're getting up multiple times a night to use the bathroom, or if you've had a fall or a near fall getting out of bed at night, that is absolutely worth a conversation with your doctor. Ask directly, should I be taking this earlier in the day? Many doctors will say yes, and it's a simple, low-risk change that can meaningfully improve your sleep and lower your fall risk. Third, if you're on more than one blood pressure medication, trust the specific schedule your doctor or pharmacist gave you, rather than a general rule you heard somewhere. Combination regimens are often personalized in ways a general video like this one simply can't account for. Fourth, pick a time of day, any time, that you can realistically stick to for the rest of your life. Some people do best right after brushing their teeth in the morning. Others do best with dinner. What matters far more than the specific hour is that you do it the same way every single day, so the medication can do its job of keeping your blood pressure steady instead of swinging up and down. And fifth, if anything about your medication feels confusing, whether it's timing, food interactions, or side effects, write your questions down before your next appointment and ask your doctor or pharmacist directly. You are allowed to ask, why this time and why this way? A good healthcare provider will always have a clear answer, and if something in your routine was set years ago and never revisited, it's worth checking that it's still the right fit for you now. Let's bring this all together. The claim that there is one specific hour after 60, when you must never take your blood pressure medication, isn't supported by the largest, most carefully conducted research we have today. The big studies, including one that followed over 21,000 people for more than 5 years, found that for most people, morning or evening dosing carries a similar level of protection against heart attack and stroke. What does matter, and matters quite a lot, is taking a water pill early enough in the day to avoid nighttime bathroom trips and fall risk, respecting food and drug interactions like the one with grapefruit, following a multi-drug schedule exactly as your doctor designed it. And above all, staying consistent day after day rather than skipping around. That's the real evidence-based picture, even if it's a little less dramatic than a single scary secret. Before you go, I'd love to hear from you. Which part of this surprised you most? Were you one of the many people who had already switched to taking your blood pressure pills at night because of something you read years ago? Let me know in the comments, and if it feels comfortable, share your age and where you're watching from, Our community here comes from all over the world, and it's always wonderful to see who's part of these conversations. And as always, please remember that nothing in this video replaces a real conversation with your own doctor or pharmacist who knows your specific health history and medications. If you found this helpful, consider subscribing so you don't miss the next video, and take care of that heart of yours. It's been working hard for you for a long time.